can you tell me about the ENLIGHTED trial as a trial in progress? Maybe talk about the mechanism of action of VTP and why that could be useful for low-grade upper tract disease.
Yes, Katie, good to be with you as well. And I think it'll be useful to kind of define the scope of the problem here. This trial addresses patients with low-grade urothelial cancer of the upper urinary tract. And as we all know, these are challenging patients because they tend to be older. They tend to have already some degree of chronic kidney disease. And, still a majority of these patients are managed with radical surgery, which, I think we can argue is overtreatment. This leads to further deterioration of renal function and all the untoward consequences of that. And so knowing the scope of the problem, it's also useful to understand that the reason why these patients are overtreated is because their management is challenging. Working in the upper urinary tract with limited tool set, it's difficult to completely, mechanically at least, destroy these tumors. And so what the ENLIGHTED trial proposes is an injection of a Padeliporfin, which is an agent, which is a prodrug, which gets activated by a laser of a certain wavelength. And the laser has to be fired simply in the vicinity of the tumor. This converts this illumination converts the prodrug into an active substance which produces free radicals and essentially preferentially destroys the tumor vasculature. So that's the premise, the mechanism of action. The Padeliporfin, unlike some of the other drugs in this class, has a very short half-life, so it's quickly in and out of the patient's system, which lessens sort of the downstream potential side effects. So the ENLIGHTED trial is a phase 3 single-arm, non-randomized, open-label trial evaluating VTP in the treatment of low-grade upper tract urothelial patients.
Yeah, so is that patients with multiple tumors and you can do multiple treatments, or single tumor, or how do you foresee, or what does the trial have and what do you foresee that being utilized, right? The multifocality is clearly a problem, with upper tract disease sometimes.
Right. So that's clearly a problem, but, obviously we have to have some parameters for a clinical trial design.
Of course.
And the trial does allow multiple tumors in renal pelvis. The largest tumor cannot be over 1.5 centimeters. It allows treatment of the tumors in the ureter, but the contiguous length of involvement of the ureter cannot be more than 2 centimeters.
Okay.
So it does allow for multifocality. We did set some parameters to sort of keep the patient population more or less uniform. The trial has an induction maintenance phase.
Okay.
The induction phase consists of up to 3 treatments separated by a month. And the primary endpoint is complete response at the end of induction phase. That's the primary endpoint. There are obviously multiple secondary endpoints as far as treatment duration, obviously side effect profile, et cetera. The maintenance phase then allows patients that achieve the complete response to have periodic ablation at 3 months intervals, so up to 3 additional ablations. So in patients that have complete response, they can have up to 6 treatments on the trial, basically. And again, the primary endpoint is a complete response after up to 3 treatments separated by a month apart.
Okay. So are they having ureteroscopies at each of those, prior to treatment, I guess, in the trial? Is that right?
So, the trial enrollment, obviously criteria are pretty strict. The patients have to have documented low biopsy-proven low-grade upper tract urothelial cancer in renal pelvis of the ureter, and lack of high-grade cytology. The tumor parameters have to fit in terms of size and location.
Sure.
And then if patients qualify, yes, they get into the active induction phase of the trial, where the ureteroscopy is performed. During the ureteroscopy, there's a 10-minute injection of the agent, followed by 10-minute illumination.
Okay.
And again, the idea here is that this is not technically demanding. You literally
Right.
have to shine the light in the vicinity of the tumor. And as we all know, ablation and destruction of this tumor is quite challenging. Here, you don't have to do any of that. Literally, you inject the agent and simply shine the light in the vicinity of the tumor, which is not technically demanding.
Sure. Yeah, that sounds really promising, especially ureteroscopy is very familiar to urologists. And like you said, sometimes the mechanical ablations with lasers based on location and other things can be really difficult. So you mentioned this kind of in passing a little bit ago, but what about adverse events related to this? Any reports of that, or really kind of focusing in on grade 3 or above? Um,
Yes, good question. So we presented some of this data at ASCO just a few days ago. Basically, there's no pre-planned efficacy analysis, but out of 13 patients that had completed the induction and treatment phase, there was a 77% complete response rate. Early, I think we don't know the durability of this, but that's the efficacy data that I can share with you. And in terms of side effects, it's actually quite remarkable. There were no grade 3 toxicities. So there are minor sort of grade 1 to 2 side effects, including flank pain, vomiting, and fatigue. All of them have resolved spontaneously with no additional, unusual intervention needed. And so I think this also potentially sets this therapy apart from some of the other modalities available in this space where, scarring and renal function loss can be a problem.
Yeah. Well, that 77% complete response sounds really good and exciting for, this patient population, of course. So what are the next kind of key milestones or outcomes, that you and the study group are hoping for in the next reports coming out of Enlightened?
Enlightened, yes. We need to finish enrolling the trial. There are 29 clinical sites open in the United States, Europe, and Israel. The sites are actively enrolling, but these patients are relatively rare. The target enrollment here is 100 patients. We have accrued a third way through, roughly, and we want to finish accrual by the end of this year. And so this is an optimistic goal, but it's doable. And I think just want to remind the urologic community that this is an overtreated disease, and I think it's imperative to avoid overtreatment when possible. And I think this trial may give us another tool in our toolbox to help manage these patients.